Continuing with the average length of stay. So what is acute patient length of stay? So it is also same as average length of stay. The only thing is that this is being calculated for patient who are acute patient, and the number of days that these acute patients spend in the hospital is called the acute patient length of stay. Now, acute patient, this average length of stay. How do it measure the quality of care in a hospital? So that is one thing, right? How can a patient staying in a hospital for 5 days or maybe 7 days, how can this indicate the quality of care? So that is a question which comes in every person's mind, right? So to address that, we have to first understand that why in the first place the average length of stay was calculated. uh, if you see uh, if you see the overall the formula of average length of stay, the total number of days divided by number of discharges, it will tell you that it does not depend upon, it doesn't tell you anything about regarding a particular patient or a particular specialty or anything like that. It is just the general number of the days divided by the number of discharges. Now, when we calculate the average length of stay, it tells you certain things which indicates various inefficiencies in the quality of care or in the efficiencies in the system or the processes of the hospital. Like it indicates what? It indicates lost opportunities to free up hospital beds. So, if the average length of stay, if one patient spends number of couple of days in the single bed, that means the hospital bed is not getting empty very fast or very frequently, which tells you that you are losing opportunity to admit a new patient into that same bed, right? Because one patient has occupied that bed for quite some time. Second point is to treat more patients. So as soon as more patient, a single patient occupies that bed for quite number of time, that means you will also lose the opportunity to admit more and more number of patients in your hospital. So that is second. The third is to reduce significant unnecessary cost. So if you see the average length of stay, it will also reduce your unnecessary cost. How does it reduce our unnecessary cost? We will learn in the next video. But when we calculate average length of stay, the ultimate thing is that a person, if the average length of stay is more, that means the number of days the patient is spending in the hospital is more. When the average length of stay is less, that means the patients are admitted for very short period of time in the hospital. They are getting admitted, they are getting treated, and they get discharged from the hospital. If the average length of stay is less, that means you are treating more and more patients, and you are freeing your hospital beds more and more, you are admitting more patients, and you are avoiding unnecessary cost. But when you see that if the hospital bed is the average length of stay is more, that means you are increasing unnecessary cost, you are treating less patients, and it is also that you are you are making the patient stay in that particular bed for a longer period of time, which may also be unnecessary. So losing opportunity to free up hospital beds. So this is what are the three inefficiencies which the average length of stay will tell you, and why it is very much important. Thank you. So we'll move to the next video now.